Namaste. Namaste and welcome you all to Prachaar 2022. Prachaar means spreading Ayurvedic wisdom. Prachaar is an annual seminar conducted on our founder Krishnakumar Ji's birth anniversary to spread knowledge on obscure areas of Ayurveda. Krishnakumar Ji was a man of action and hardly a man of celebrations. But he is someone who should be celebrated for his contributions to uplifting and globalizing Ayurveda and other Indic sciences, for not being afraid to fight, the fight that was right and no one was fighting for plural beings, that he was for everyone who has ever known him and inspired by him. He was and is one of the very few people in Ayurveda who hardly needed an introduction in India and abroad. For more than 40 years, he was involved in establishing and propagating Ayurveda as a medical system of world standards, and he brought Ayurveda to the attention of WHO. Since taking charge of the EVP group, he managed to put Ayurveda in front of the world as a science by supporting research activities and encouraging educational programs, as well as standardizing medicine production and Ayurvedic treatments via multiple institutions of excellence. On his birth anniversary, let's make a promise to take his legacy forward. Krishnakumar Ji is always used to say that his flagship institutions stands for Achar, Vichar, and Prachaar. Achar means practicing Ayurveda. Vichar means thinking or developing one's own thought process in Ayurveda. And Prachaar means spreading Ayurveda or globalizing the science. He believed that his purpose in life was Achar, Vichar, and Prachaar of Ayurveda and other Indian systems of knowledge. And he lived by that principle and urged those who were drawn to him to do so. We will begin our program with a prayer.
Hari Om. Ananta samsara samudratara naukayitabhyam guru bhaktitabhyam.
Recording in progress.
Vairagya samrajyatha sarjanabhyam ajyatha sarjanabhyam ajyatha
Sorry for the technical issue. We have some connectivity issues. We will resume the prayer.
Hari Om, Namaste. Ananta samsara samudratara naukayitabhyam guru bhaktitabhyam vairagya samrajyad pujanabhyam namo namaha Shri Guru Padukabhyam Kavitvarasi Nisagarabhyam Daurbaghyadavam Buddhamalikabhyam Durikrudanamra Vipatidabhyam Namo Namaha Shri Guru Padukabhyam. Thank you.
Our institution, Ashirwad Health and Educational Trust and Sharanya Ayurveda Hospital, was founded by Krishnakumar Ji. He was a regular visitor on our campus and interacted personally with our staffs from all levels, housekeeping to managers. He was a beloved figure to them and has left huge impacts on a lot of their lives. We have asked some of them to share their memories of Krishnakumar Ji with everyone. It is a pre-recorded video to add English translation. Let's hear them now.
നമസ്തേ ശ്രീ ഗുരുഭ്യോ നമ. കൃഷ്ണകുമാർജിയുടെ എൻ്റെ ഗുരുനാഥൻ്റെ ജന്മദിനമാണ്. എൻ്റെ കാണപ്പെട്ട ദൈവവും ഗുരുവും അദ്ദേഹമാണ്. എനിക്ക് ആയുർവേദത്തിലേക്ക് വരാനും ഇതിൽ ഇത്രയും ജനങ്ങൾക്കൊരു സേവനം ചെയ്യാനും ആത്മീയപരമായും ആശയപരമായും എൻ്റെ ഒരു വഴികാട്ടിയാണ്. എൻ്റെ ജീവിതത്തിലെ ഏറ്റവും വലിയ ഒരു നിമിഷങ്ങൾ സമ്മാനിച്ചിട്ടുള്ള വ്യക്തിയാണ്. അദ്ദേഹത്തെക്കുറിച്ച് ഇന്നും നമ്മളെ വിട്ട് പിരിഞ്ഞു പോയിട്ടുണ്ടെങ്കിലും ഇന്നും എൻ്റെ കൂടെ അദ്ദേഹത്തിൻ്റെ സാന്നിധ്യം ഞാൻ എപ്പോഴും അറിയാറുണ്ട്. എപ്പം നമ്മളൊരു ബുദ്ധിമുട്ടി നിൽക്കുന്ന ഒരു സമയം വരുമ്പോഴും നമ്മൾക്ക് നല്ല ശക്തി, ആത്മബലം തരുന്നതും കായിക ബലം തരാനും അദ്ദേഹത്തിൻ്റെ പല ക്ലാസ്സുകളും എനിക്ക് ഉപകാരപ്പെട്ടിട്ടുണ്ട്. എന്നെ മരിക്കുന്നവരെയും ഇവിടെ വരുമ്പോൾ എനിക്ക് എൻ്റെ അടുത്ത് വന്ന ഓരോ ഉപദേശങ്ങളും ഓരോ ദിവസവും തന്നുകൊണ്ടിരുന്ന ദൈവതുല്യനായിട്ട്, ദൈവമെന്ന് തന്നെ പറയാം. അത്രയും എനിക്ക് എൻ്റെ ആത്മഗുരുവിന് മനസ്സിൽ ഞാൻ ധ്യാനിച്ചുകൊണ്ട്
1984 മാർച്ച് മാസത്തിലാണ് ഞാൻ ആദ്യമായി കൃഷ്ണകുമാർജിയെ കാണുന്നത്. അന്നാണ് ഞാൻ കമ്പനിയിൽ ജോലിക്ക് പ്രവേശിക്കുന്നത്. മാർച്ച് മാസത്തിലാണ്. അദ്ദേഹവുമായി അടുത്തിടപഴകാൻ സാധിച്ചത് 2011 മെയ് മാസം മുതലാണ്. അന്നാണ് നവക്കര അമ്പലത്തിൻ്റെ പ്രതിഷ്ഠാകർമ്മങ്ങൾക്കുള്ള പ്രോഗ്രാമുകൾ തുടങ്ങുന്നത്. അന്നാണ് ഞാൻ ഇവിടെ വന്ന് അമ്പലത്തിലെ ജോലിയിലേക്ക് പ്രവേശിക്കുന്നതും അദ്ദേഹവുമായി കൂടുതൽ അടുത്തിടപഴകാൻ സാധിക്കുന്നത്. ക്ഷേത്രം ആരംഭിക്കുന്നതിന് മുൻപ് തന്നെ ക്ഷേത്രം പ്രവർത്തനക്ഷമമായാൽ അതിലേക്ക് ആവശ്യമായ പുഷ്പലതാദികളെല്ലാം ലഭിക്കുന്നതിനുള്ള എല്ലാ ഇതും അദ്ദേഹം ഇവിടെ ചെയ്തു തന്നിരുന്നു. അത് കാരണം അമ്പലത്തിലേക്ക് ആവശ്യമായ പുഷ്പങ്ങൾ ഇവിടെ തന്നെ നിർബാധം ലഭിക്കുന്നുണ്ട്. അമ്പലത്തിൽ വരുന്ന എല്ലാ ഭക്തജനങ്ങൾക്കും എന്തെങ്കിലും പ്രസാദം കൊടുക്കണമെന്നുള്ളത് അദ്ദേഹത്തിന് ഒരു നിർബന്ധമുള്ള കാര്യമാണ്, പ്രത്യേകിച്ചും അന്നദാനം.
നമസ്കാരം. നമ്മുടെ MD സാറെ പറ്റി പറയുകയാണെങ്കിൽ, ഞാൻ ഒരു 76-77 മുതൽ ഈ കമ്പനിയിൽ ജോലിയിൽ പ്രവേശിച്ചാണ്. മൂപ്പര് വന്നിട്ട് തൊഴിലാളികൾക്ക് ഒരു തൊഴിലാളിയായിട്ടല്ല, ഒരു ഫ്രണ്ട്സ് മാതിരിയാണ് മൂപ്പര് എല്ലാവർക്കും പെരുമാറുക. നമ്മൾക്ക് എന്ത് വേണമെങ്കിലും മൂപ്പര് സംസാരിച്ചാൽ ജോലിയുടെ കാര്യം അനുസരിച്ച് മൂപ്പര് ഉടനെ മാറ്റിത്തരും. പിന്നെ ഒരു കാലയളവിൽ ജോലി ഇല്ലാണ്ട് കമ്പനി പൂട്ടുന്നുള്ളൊരു നിലവാരത്തിലായിരുന്നു. 77-80 ഉള്ളിൽ 80 ആ സമയത്ത് ഞങ്ങൾക്ക് ശമ്പളം കിട്ടിയിരുന്നില്ല. ചില ശമ്പളം കിട്ടാണ്ട് കഷ്ടപ്പെട്ട ഒരു കാലവധിയിലത്. ഞങ്ങൾ യൂണിയൻകാരെല്ലാം കൂടി പോയി ഒരു ദിവസം വൈകുന്നേരം വീട്ടിൽ പോയി, രാജമന്ത്രി എന്ന് പറയാം, രാജമന്ത്രി പോയി സാറിനെ കണ്ട്, സാർ എങ്ങനെ കാര്യങ്ങൾ ശമ്പളം വരെയായി കിട്ടില്ല, ഒരു MD സ്ഥാനം അന്നൊന്നും ഉണ്ടായിരുന്നില്ല. അപ്പോഴാണ് ഞങ്ങൾ പോയി പറഞ്ഞപ്പം മൂപ്പർ ഒന്നും പേടിക്കണ്ട, ഇനി മുതൽ നിങ്ങൾക്ക് ശമ്പളം മര്യാദ കിട്ടിയോളും എന്ന് പറഞ്ഞിട്ട് ഞങ്ങളെ സമാധാനപ്പെടുത്തി വിട്ടു. മൂപ്പർ സ്ഥാനം ഏറ്റെടുത്തു എന്നുള്ളത് പറയാം. MD സ്ഥാനം അന്ന് മൂപ്പർ ഏറ്റെടുത്ത് ഈ കമ്പനി ഇത്രയും പുരോഗമിക്കാൻ കാരണം മൂപ്പർ ഒറ്റ ഒരാളുടെ ഇതാണ്.
എൻ്റെ പേര് കണ്ണൻ എന്നാണ്. ഞാൻ 2000 തൊട്ട് ആയുർവേദ ഫാർമസി രാമനാഥപുരത്ത് വർക്ക് ചെയ്യുന്നു. അത് കഴിഞ്ഞിട്ട് 2012 തൊട്ട് ഞാൻ ശരണ്യ ഹോസ്പിറ്റലിൽ വർക്ക് ചെയ്യുന്നുണ്ട്. ഇത് കൃഷ്ണകുമാർ സാറിനെ പറ്റി പറയുകയാണെങ്കിൽ എനിക്ക് അത് വലിയ കാര്യമായിട്ടാണ് തോന്നുന്നത്. നിങ്ങൾക്കത് കേൾക്കുമ്പോൾ ചെറിയ കാര്യമായിട്ട് തോന്നാം. അവിടെ വന്ന ടൈമിൽ ഞങ്ങൾക്ക് ക്ലാസ് ഉണ്ടായിരുന്നു, അദ്ദേഹത്തിൻ്റെ ഒരു ക്ലാസ് ഉണ്ടായിരുന്നു. ഞങ്ങൾ നിലത്തിരുത്തിയിട്ട് അദ്ദേഹം ഞങ്ങൾക്ക് ഓരോ ക്ലാസ്സുകൾ പറയുമായിരുന്നു. അതിൻ്റെ ഇടയ്ക്ക് ഒരു ചോദ്യം ചോദിച്ചു, ഒരു മനുഷ്യൻ്റെ മനസ്സിൽ എത്ര ചിന്തകൾ പായുമെന്നുള്ള ഒരു കാര്യം അദ്ദേഹം പറഞ്ഞിരുന്നു. ഞാൻ അതേപ്പറ്റി ആലോചിച്ചിട്ടുണ്ടെങ്കിൽ ഇപ്പോൾ എന്നെ നോട്ട് ചെയ്തതാണോ പെട്ടെന്ന് എൻ്റെ അടുത്ത് ചോദിച്ചു, നിന്റെ മനസ്സിൽ എത്ര ഇപ്പോൾ ഓടി എന്ന് ചോദിച്ചു. അങ്ങനെയാണ് അദ്ദേഹത്തോട് ആദ്യമായിട്ട് ഞാനൊന്ന് സംസാരിക്കുന്നത് തന്നെ. അത് കഴിഞ്ഞിട്ട് എനിക്ക് KR നാരായൺ സാറിനെ വർക്ക് ചെയ്യാനായിട്ട് പറ്റിയിട്ടുണ്ട്. ആ സമയത്ത് ഞാൻ ഫസ്റ്റ് ട്രീറ്റ്മെൻറ്റ് ചെയ്യുന്നത്, അതായത് വന്നിട്ട് കുറച്ച് നാളെ ആയിട്ടുള്ളൂ. എനിക്കത് കിട്ടാൻ ഭാഗ്യം തന്നെ അദ്ദേഹത്തിൻ്റെ കാരണമാണെന്നാണ് എനിക്ക് തോന്നിയിട്ടുള്ളത്. കാരണം എനിക്കത് എന്നെക്കാളും സീനിയർ ആയിട്ടുള്ള ആൾക്കാരുണ്ടാവും, പക്ഷെ എന്നിട്ട് പോലും എന്നെ അതിൽ ഉൾപ്പെടുത്തിയിട്ടുണ്ടായിരുന്നു. അവിടെ ചെന്നു ഫസ്റ്റ് KR നാരായൺ സാറിനെ ചെയ്യാനായിട്ട് പോകുമ്പോൾ ധാര ചെയ്യുന്നതിൽ ഞാൻ അതിൽ എണ്ണ മുക്കി ഒഴിക്കുന്ന ഒരു ഇതിലാണ് ഞാൻ ചെയ്തുകൊണ്ടിരുന്നത്. അത് മുക്കി ഒഴിക്കുമ്പോൾ എണ്ണ കൂടി പോവുകയും ചെയ്തു, അതിൻ്റെ ഫ്ലോ ഭയങ്കരമായ രീതിയിൽ വരികയും ചെയ്തു. അതുകൊണ്ട് മുക്കി ഒഴിക്കലും ഇത് ഒന്നും നടക്കാത്ത ഒരു രീതിയിൽ. അപ്പോൾ അദ്ദേഹം അവിടെ നിൽപ്പുണ്ടായിരുന്നു. അദ്ദേഹം എന്നിട്ട് പറഞ്ഞു അതൊന്ന് താത്തി അങ്ങനെ ചെയ്യാനായിട്ട് അദ്ദേഹം പറഞ്ഞു. അങ്ങനെ ഒരുപാട് സഹായങ്ങൾ എനിക്ക് ചെയ്തു തന്നിട്ടുണ്ട് അദ്ദേഹത്തിൻ്റെ. അത് ഒക്കെ എനിക്ക് വലിയ കാര്യമായിട്ടാണ് തോന്നിയിരിക്കുന്നത്. പിന്നെ അതേപ്പറ്റി നല്ല അഭിപ്രായങ്ങളേ ഉള്ളൂ.
നമസ്കാരം. കൃഷ്ണകുമാർ സാറുടെ ഒരു എക്സ്പീരിയൻസ് പറയണത് അത് ഒരു വലിയ സംഭവങ്ങളാണ്. വൈഫ് വന്നിട്ട് പ്രഗ്നൻ്റായിട്ടിരിക്കുകയാണ്. ആ സമയത്ത് വന്നിട്ട് കൊണ്ടുപോയി 2020 ഞങ്ങൾ കൊണ്ടുപോയി അഡ്മിറ്റ് ചെയ്തു. അന്ന് വന്നിട്ട് ഓപ്പറേഷൻ ചെയ്യണം പറഞ്ഞിട്ട് ഡോക്ടറൊക്കെ പറഞ്ഞു. അപ്പോൾ എനിക്ക് എന്താ ചെയ്യണമെന്ന് ഒരു പിടുത്തം കിട്ടിയില്ല. അപ്പോൾ ഓപ്പറേഷൻ ചെയ്യണം, 10 ലക്ഷമാവും, 15 ലക്ഷമാവും, ഒരു 10-12 ലക്ഷം രൂപ അഡ്വാൻസ് ആയിട്ട് അടയ്ക്കാൻ പറഞ്ഞു. അപ്പോൾ എന്താ ചെയ്യാൻ പറ്റാമെന്ന് ഒരു ആലോചനയ്ക്ക് വേണ്ടി ഗിരീഷ് സാറിനെ വിളിച്ചു. അപ്പോൾ ഗിരീഷ് ചേട്ടനെ വിളിച്ചപ്പോൾ പറഞ്ഞു ഇപ്പം തന്നെ വിളിക്കുക സന്ദീപ് പറഞ്ഞിട്ട് അവിടെ ഹോസ്പിറ്റലിലേക്ക് എത്തി. അടുത്ത സെക്കൻഡ് വന്നിട്ട് കൃഷ്ണകുമാർ സാറിനെ വിളിച്ചു. ദൈവത്തിനെ വിളിച്ചപ്പോൾ അടുത്ത ഫോണ് വന്നിട്ട് അവിടുത്തെ ഉടമസ്ഥനെ വിളിച്ചു, സംസാരിച്ചു. മറക്കാൻ പറ്റാത്ത ഒരു സമയങ്ങളാണത്. അടുത്ത ആ അരമണിക്കൂർ 3/4 മണിക്കൂറിൻ്റെ ഉള്ളിൽ എൻ്റെ ടൈമിങ് മാറി. ആ സമയത്ത് വന്നിട്ട് സാറ് വിളിച്ച ഒറ്റ ഫോൺ കോൾ. 2 ദിവസം കഴിഞ്ഞിട്ട് നോർമൽ ഡെലിവറിയാണ്, ട്വിൻ ബേബീസ്, 2 പെൺകുട്ടികൾ എനിക്ക് സ്വത്തായിട്ട് കിട്ടി. അത് വന്നിട്ട് കൃഷ്ണകുമാർ സാറുടെ ബ്ലെസ്സിങ് ആണ്. ഫസ്റ്റ് ഫോൺ സാറിനാണ് വിളിച്ചെന്നാണ് പറഞ്ഞത്. സാർ ഇങ്ങനെ വന്നിട്ട് എനിക്ക് എൻ്റെ കുട്ടികൾ ജനിച്ചു സാർ, സാറിന് ഭയങ്കര സന്തോഷമാണെന്ന് പറഞ്ഞപ്പോൾ സാറ് കരഞ്ഞു. അത് എനിക്കും വന്നിട്ട് അന്ന് വന്നിട്ട് ഭയങ്കര ഒരു ഇത്ര വലിയൊരു മനുഷ്യൻ വന്നിട്ട് ഒരു അക്കൗണ്ടൻ്റായിരുന്നു. ഞാൻ അവിടുത്തെ സ്ഥാപനത്തിൻ്റെ ഒരു അക്കൗണ്ടൻ്റാണ്. അക്കൗണ്ടൻറ്റിനെ വന്നിട്ട് ഇത്രയ്ക്കും വിളിച്ച് പറയണമെന്ന് ആർക്കും ഉണ്ടാവില്ല. എത്രയോ പണികളുണ്ടാവും. ഞങ്ങൾ പൈസയ്ക്ക് പറയല്ല, 18 ലക്ഷം 20 ലക്ഷം എന്ന് പറഞ്ഞ സ്ഥലത്തിൽ വെറും 85,000 ഒതുക്കിയിട്ട് ഞങ്ങൾ വന്നു. ഇത്ര പറയാനുള്ളൂ. പറയുമ്പോൾ എനിക്ക് ഭയങ്കര വിഷമമാകുന്നുണ്ട്. താങ്ക് യു.
പിന്നെ
Now let us take a moment to bow before his memories. We shall continue with Prachaar 2022. Today we have with us Dr. Jigish PP. Dr. Jigish PP has graduated from Vaidyaratnam Ayurveda College, Ullu, and did his post-graduation in Panchakarma from Government Ayurveda College, Thiruvananthapuram. Soon after his post-graduation, he joined as a faculty in VPSV Ayurveda College, Kottakkal, where he is a professor and HOD of Panchakarma department. He has published over 15 papers and has guided over 20 students. He is known for his soft-spoken nature and versatile preparatory. He is very well versed in traditional as well as scientific practices of Ayurveda, and today he will guide us and broaden our perspective on Murdhani Thailam from very few oils. We welcome you, sir.
Thank you. Shall I share the screen?
Yes, sir, please.
Is it visible?
Sir, can it be in a
A
full
plain
screen?
slide. A plain slide.
Yes, yes.
Okay. So, namaste to all. First of all, my humble pranams to Guruji, Padma Shri, Krishnakumar Ji. Actually, it is a honor for me to participate in this gathering. And I'm very thankful to the organizers for inviting me for lecture in this meeting in connection with the 71st birth anniversary of Krishnakumar Ji. Actually, I had only 2-3 occasions to meet Guruji. I was introduced to him by one of my teacher, Dr. Kiradamurthy. So that time we spoke only for 4 to 5 minutes. I just got introduced. Then after a long time, when I got a chance to meet Krishnakumar Ji, I started reminding him about me. So just I told my name. So suddenly he recognized and he told, he was asking about me, whether he has come or not, like that. So I never expected that he will be remembering me. So it was a great occasion, and still I remember his words in those times. So again, humble pranams to Guruji. He was a great physician. He was so humble and knowledgeable, and he has put maximum efforts to popularize Ayurveda and to make it scientific also. So today I will be dealing with the topic Mūrdhani Thailam, the secret to Sukhayu. So as far as the Kerala practice is concerned, many people come saying that after applying an oil, they got many complaints. Or when they applied some oil over the head, they got neck stiffness, heaviness, or joint pain, or attack of asthma, running nose, sneezing, fever, etc. So this is a usual complaint what we get in our clinic. There is another group who say that they had some complaints like joint pain or or asthma or like tinnitus or stye, etc. And after consulting a traditional physician or a doctor, he prescribed some oil to put over head. And after applying the oil, his complaints got reduced. They got cured. So these two things we usually get in our clinics. So it is nothing but about the Mūrdha Thaila. So Shirabhyanga is a part of daily routine, especially in southern India. So here usually the head oil application is seen as a daily routine. And as a method, a best method for hair care, it is there in the practice. At the same time, it is considered as an important method to cure some practice. So apart from a hair care method, it is considered as a important step taken to prevent certain pathologies. There is a proverb called "Thalakkenna enna thekkaruthu." So without knowing the condition of the head, never prescribe any oil, never put any oil over the head. Or without proper consideration, without knowing about something, never do it. So this is also the, usually we use this proverb in many situations. So, which shows that the Shirabhyanga is very important. So coming to the Mūrdha Thaila, classical perspective, it is explained as Shirasi yat Thailam diyade tad Mūrdha Thailam uchyate. So application of Thaila over head, that is considered as the, or that is known as the Mūrdha Thaila. There are 4 methods like Abhyanga, Sega, Piju, and Vasti. Murdhani Thailam, Mastishkyam, Shirasa Tarpanam, Shirasa Pradipuranam. These are the synonyms used to denote Mūrdha Thaila. As I told, there are 4 methods, that is Abhyanga, Sega, Piju, and Vasti. As per the classics, the potency increases in the ascending order. So Shiravasti has the maximum potency. Below that, Piju. Below Piju, it is Sega, and below Sega, it comes Abhyanga. So Shiravasti is the maximum potent method. If we take the practice, we can see that we are practicing in a descending order. So maximum we practice Abhyanga, then Sega, then Piju, then Vasti. So Shiravasti is least practiced among these 4 methods. So there is a confusion. When there is a there is a method which is considered as the best one, why should we select the other 3 methods? If Shiravasti is the best method, then why should we select the Abhyanga, Sega, and Piju? The thing is that each has specific indications. Abhyanga has some specific indication. Sega is indicated in some other conditions. Piju is indicated in some other conditions. So each of these has some specific indications. So in a condition where Abhyanga is indicated, if we practice Shiravasti, definitely it can increase the complaints. So there is a logic behind the selection, behind the classification of Mūrdha Thaila. Coming to Shirabhyanga. So I'll be dealing with the Shirabhyanga only. So Shirabhyanga, it is explained as Thailena Shiraso Murdhanam. So that is the massaging the head with the oil. That is considered as the Shirabhyanga. in Shargadhara Samhita, in the commentary, Deepika commentary, it is explained as Abhyanga Chapadana Matra Shirasyeva. So Chapadana Matra, this term is used. Chapadana, Chabeda, this term means an outstretched hand. So you can see in the picture, this is the usual method what we practice. We take the oil which is there only in the palm. Then that is applied over the head. So always our fingers will be outstretched. So that is used. So only this much amount is used for applying the Shiroabhyanga. So it shows the amount of oil used for Shiroabhyanga. So least amount of oil is used. Considered to other methods like Sega, Piju and Basti, minimum amount of Thaila is used in Shiroabhyanga. And it is suitable in Vada and Kapha associations. Of course, Mūrdha Thaila is indicated in where Vada is vitiated in the Shiras or Urdhvanga. Okay. There is clear indication in Vada conditions. Along with that, if we see the associations of dosha, if Kapha is associated with Vada, there also Shiroabhyanga is indicated. So whereas if Pitta is associated, then there will be Sega. And if it is a typical Vada condition where there is maximum Vada Gopa is there, in those conditions, Shiravasti is indicated. So actually this classification or the indication is based on the Dosha Kopa. So that is the most important one. So we can see the Abhyanga is indicated in Tatra Abhyanga Prayoktavyo Rauchya Kandu Maladishu. So Rauchya, where the Vada is located in the skin, Vada is vitiated. And other conditions like Kandu Maladi, these conditions denotes that there is association of Kapha. Kandu Mala, etc. are features of Kapha. So when Kapha is associated, there, if we want to do Mūrdha Thaila, Abhyanga should be selected. So it is indicated in local skin lesions, dryness, and also it cleanses the scald. If we take the general qualities of Mūrdha Thaila, it is indicated in Ghaladi, Palida, Vali, Hariloma, these conditions. And also in Shirogata Roga, when there is some disease affecting the Urdhvanga, and where there is Indriyahani, when the sense organs are affected, in these conditions, generally we can say that the Mūrdha Thaila or Shiroabhyanga is indicated. These are the merits explained by Charaka. I'm not going to the details, but see that Nityam Snehardra Shirasa Shirashulam Najayade, Naghalityam, Nabalityam, Nakesha Prabadandicha, Balam Shirakabaranam, these things. Dridhamulasta Dirkhasya Krishna Kesha Bhavandicha. Many of the conditions related to hair are mentioned. This is from Sushruta. Here again, Shirogadam Stadharogan, Shirobhangopakarshadi, Keshanam Mardavam Dairkyam, Bahutvam Sniktha Krishnadam, Karodi Shirasas Triptim, Sutaktam Abhichananam, Sandarpanam Cha Indriyanam, Shirasa Pradiguranam. So these are the merits explained by Sushruta. Coming to Vagbhada, Kaja Shadana Sidatva Pinjaratvam, Paripudanam, Shirasa Samira Rogan, Jayadi, Janayadi Indriya Prasadam, Swara Hanu Mūrdha Balancha Mūrdha Thailam. So these are the qualities, these are the advantages of Mūrdha Thaila. Even we can equate we can consider as qualities of Shiroabhyanga also. So we can see that in a classical perspective, Shiroabhyanga is considered as a part of daily routine. Abhyangam daily it is indicated. As a part of a treatment procedure also it is indicated. When we see the Sweda procedures, Snehana should be applied, especially Sniktha Sweda. So there both the head and body should be massaged with the oil. So as a part of treatment procedure also it is indicated. When there is Vadagoba in head, Mūrdha Thaila or Shiroabhyanga is indicated. And as I told while describing the sloga from Charaga, many of the things are related to the cosmetic effects. Here you can see, even in Ashtanga Hridaya, Kaja, Shadana, Siddhatva, Pinjaratva, Paribodhanam. All these are related to the hair. Okay. Then some of the conditions which affect the Indriyas or where Shirasi is affected. So we can see that it is indicated in some limited conditions. So those conditions affecting the head, Murdhani Thailam is indicated, or Shirabhinga is indicated. If you see the classics, you will get some 3-4 oils exclusively mentioned for Shirabhinga. If you see the Shiroroga Pradisheda, 2-3 oils you will get. And nobody has mentioned about the method of procedure, the operative procedure. They have explained the merits of Shirabhinga or Murdhani Thailam in detail, but how to do the procedure, it is not mentioned. We get complete reference of operative procedure for Panchakarma and some other procedures also, like Shirovasti. There is a clear-cut description of the procedure, but there is no reference regarding how to do the Shirabhinga or how to perform the Shiropiju. These references are not there in any classics. Coming to Kerala practice, in Kerala, actually, Shirabhinga is an effective therapeutic procedure perfected by the keraleeya ayurvedic practices. So more than whatever explained in classics, they have developed this as a separate procedure. The Shirabhinga has been considered as a separate procedure, and they have developed as a innovation by the ancient scholars. And we can consider that it is an indigenous origin. So generally, when we discuss about the evolution of procedures, how the prevailing system of practice came into. So how the procedures evolved. So we have methods to practice different procedures like Shirabhinga or Shiropiju or Shirasega. We have some methods. So how this evolved? So there was a meeting in our college connected to a thesis work. It was a focus group discussion. So in that, two opinion came how the procedures evolved. It was about the evolution of dhara. So two opinions came in that. So one was Ayurveda came in Kerala through the Vagbhada. Then from Vagbhada, his disciples. From there, Ashtavidya, they got trained, and they taught and made their own school of thoughts, and like that, this developed. And the ancient scholars, they developed some methods, and like that, the current procedure evolved. There is another thinking that already there was some method, some practice was there, some indigenous practice was there in Kerala. And when Ayurveda came, it got mixed with this indigenous system and further developed. Why it is considered like that? Again, as I told, we have a complete description of Shirovasti. When we see the reference of Shiropiju or Shirasega, in the commentaries it is given as Spashtam. So it was understood, or it was Spashtam to the practitioners who were there in those times. So that is why already there was some system, some indigenous system was there. So only this procedure, Shirovasti, has been added to that. So even this Shirobhyanga can be considered as indigenous origin. As I told, it is considered as an exclusive treatment option adopted in many conditions. There are some conditions in that, as per some tradition, they use this Shirobhyanga as an important method to prevent such pathologies. And in many conditions, not only in Vata, in many conditions of other doshas also, this Shirobhyanga is practiced. If you see the Kerala text, you will get thousands of formulations for applying over the head. There are many formulations. If you see a text called Arogya Raksha Kalpadruma, which is written by a renowned scholar, Kaikulangara Ramavariyar, it contains many formulations which are indicated for applying over the head. As I told, this tradition is still there in the practice. There are some traditions, there are some physicians, some school of thought, though they practice Shirobhyanga as a separate treatment to prevent many pathologies. In almost all conditions, they apply the Shirobhyanga. Then again, when we go to the regional text, Kerala text, there are some references for how to apply the oil over the head, what all precautions should be taken. There are some guidelines in some texts like Vaidya Manjari. Apart from the textual descriptions, there are certain practices, some ethnographic practices are there, which we will not get any reference, but it is there in the practice. So as far as the Kerala practice is concerned, it shows effect on whole body. Not only related, not only confined to head or urdhvanga, they apply this method, Shirobhyanga, in almost all conditions which affect the whole body. So it has a wider application in treating different pathologies. If you see the regional text like Chikilsa Manjari or Yoga Mrda or Sarvaroga Chikilsa Nool, you can see that there is indication of Shirobhyanga from Jara to Vadacholita. In all chapters, they have indicated some oils for applying over the head. These are some examples from Sarvaroga Chikilsa Nool. Here you can see in Jara, Vashapatradi Tailate, Talayil Tekayumuttamam. So for head, you can apply Vashapatradi Taila. Then for Rekta Pitta, you can apply Lakshadi Taila over the body and Chandaradi Taila for head. For Kasa Shwasa, Lakshadi Taila for body and for head, Tribhaladi Taila. In Adisara, Lakshadi Taila for head, for body, and Shatpadadi Taila, that is Arugaladi. In the market, it is known as Arugaladi for head. In Mutragrachra, he advises to apply Shida Taila over the head. Also, Virajana also indicated. Then in Prameha, Baladhatriyadiyam Tailam Talakketa Utam. So for head, Baladhatriyadi Taila can be applied. So like this, you will get many references of head oil in different chapters. As I told, it is an effective measure to prevent certain pathologies. So it is more than mere application overhead. So naturally, there will be doubt why it is more prevalent in Kerala. So we can say that in Kerala, still the lifestyle based on Ayurvedic principles are followed. Many things which explained in the text, still you can see in Kerala daily routine life. Then you can see the geographical peculiarities of Kerala and also the seasonal characteristics. Even though 6 Ridus mentioned in classics, in Kerala, mainly we get 6 months rain, almost 6 months rain will be there. Then few features of Hemanta will be there, not fully observed in Kerala. Only some of the features you will get. Sharat and Shishira is very minimum in Kerala. So these seasonal characteristics also influences the practice in Kerala. So why this Mūrdha Thaila is important? Naturally, we have to think of the importance of head. So the structural and the functional importance of head, that should be considered. Then again, there is a particular doshagati starting from head. I will explain later. So Shiras is a seat, or it is a site, principal site of a particular doshagati. Then it is also considered as a method for drug administration to Madhyama Roga Marga. So Shiro Hridaya Vastyadi Marmanyasthanam cha Sandhaya Tadnibaddha Sirasnayu. So head is a Shiras is comes under Madhyama Roga Marga. So we can see in many conditions where Shiras is affected, especially like Sannivada Jura or Vadavyadis, there you can see that there is application of some medications over the head. So it is a route of drug administration. It can be considered as a route of drug administration to Madhyama Roga Marga. Coming to the importance of head, head is the control center for every functions. These references everybody will be knowing. Urdhva Moolam Atha Shakham. Then Jalasiktasya Vardhante Yatha Moolen Gurastaro Tatha Dhadu Vivardhirhi Sneha Siktasya Jayade. Like when we pour the water in the root, which produces the growth of the plant, like that if you pour sneha over the head, that can produce dhadu vruddhi in the body. Then Shiras is the important structure where all the indriyas are confined. Sarvendriyani yenasmin prana yenacha samshrada. So it is an important site of prana also. So it is a site for all dosha, including Vekta. It comes under the Desha Pranayadana. It's one among the Trimarma, the 3 marmas, which are very important, most important points. And if you see the total number, you can see that head contains maximum number of marma. And if you see the siras they are also more seen in head as per the description. It is one of the sensitive area, and as I told, it has some relation to the Madhyama Roga Marga. This is a reference given in Sushruta Samhita, Dalhana Vyakhyana, where he says that all the doshas have some relation to Shiras. All the doshas have some location in the Shiras. So including the Rekta also. Siranam Sarvagatva Rektasyabi Shirasisthanam is mentioned. When we see the importance of Vada and relation to Shiras, Shiras is the seat of Prana and Udana, Buddhi, Indriya, Hridaya, Mana, Dhamani, Dharana. These are brought by the Pranavayu. Prana is the most important Vayu among Panchavayu. Then Udana, next is Udana, which produces the Srodha Prinana. So then Vayu is located in the Tvak also. Tvak is the seat of Vada. So Abhyanga works at a Vada Sthanam. Then we can see that there are abundance of Roma and Roma Kuba, and they have some relation to Asti. So through the Siras, Asti Poshna happens. So through these Siras, we can reach to Asti also. Relation of Pitta and Siras. Alojaka Pitta is there, Bhrajaka Pitta is there. Then as far as the Ashraya Bhava is concerned, Rekta also. Kapha, which is the Shiras, is the main site. Already it is explained. Sneha Sandarpana Adhikartatva. Already it is mentioned. Rekta has also some relation to Shiras. So if we see the formation of different structures like Jihva, etc., Rekta has a major role. And again, the hair follicles and dhamini, these are related to, they have some relation. The hair follicles, they are related to dhamini, and through this dhamini, the virya of the medicine or the sneha gets absorbed into the body, and that circulates all over the body. And when we see the diseases of head, there also it is explained as kapha asra bhuyishta. So many of the disease has a relation with the kapha and the rekta. When we see the structural peculiarity of Mastishka, it is explained as Artha Vilina Kridagara. Krida in a Skannavastha. So that is the consistency of the Mastishka explained in our text. So this consistency should be maintained. That is very important. When we see the Dosha Samya, Kapha and Pitta, or Kapha and Ushna, or the presence of Agni, these are interrelated. So when the Ushna is reduced, when the Agni is reduced, when the internal heat is reduced, Kapha will be increased. And when the Agni gets increased, again Kapha will be reduced. So there is a balance between the functioning of this internal heat, that is the Pitta, and Kapha. So to control this Pitta, Kapha has been placed in the upper part. This is explained in Sushruta Samhita. So there are many factors increasing the heat in the body. Say, for example, when we, if the atmosphere is hot, that can produce some heating effect in the body. Or when we do some procedures like a Sweda procedures, that also can increase the body temperature. Without this also, the internal rise of temperature can occur. When we do some Anagnaya Sweda, by some adjustments, by changes in the body, the internal heat is increased. So there are many factors which increases the heat. When heat is increased in the body, especially over the head, it can produce abhishyanta to kapha. It can produce kapha kopa. So that is why Ushnambusnana is contraindicated over the head. Head should not be washed with Ushnambusnana. So that can produce kapha kopa. It can lead to abhishyanta. Along with that, it can produce vitiation of rekta also, contributing to kleda. So either it can produce some disease related to the sense organs or head. Kapha, rekta, sammishra, dosha kopa can lead to some disease pertaining to head. Or it can lead to shakha roga. So there are some conditions which affect or which present with the features of features confined to limbs. So that is why it is considered as Shakha Roga. But this samprapti starts from the Shiras. Even though it is manifested in the limbs, it starts from the Shiras. So these diseases have been explained in some Kerala literature, especially Arogya Raksha Kalpadruma. So here there is a unique pathology of shifting of dosha from head to body. In Malayalam, it is called as Neerarakam. There are 8 rogas explained in this manner. In Arogya Raksha Kalpadruma, it is explained as Kapha Rakta Aniladhara Drishyante Ashtavidhaschati. So there are 8 diseases which comes under Shakha Roga. Rektodbuddha, Asrashobha, Kubaga, Ajagallaga, Itmaga, Gallaga, Indriyarma, Datmika. So these are having some relation to Kapha, Rekta and Anila. Or the vitiation of Kapha, Rekta and Vata leads to these conditions. So this is an example of, one condition coming under this Shakha Roga. So you can see, Kubidena kaphenetya murchanam rektamulbanam vayana unmargacharena branunna shirasaschudam bahu sandhim samasadya tatra stabdham samunnamal. There are some other features also explained. So see, Kubidena kaphenetya murchanam rektamulbanam vayana unmargacharena branunna shirasaschudam bahu sandhim samasadya tatra stabdham samunnamal. So it starts from the Shiras. So there is vitiation of Kapha and Rekta, and this Kapha and Rekta, when they are forcefully taken by Vata, it descends from the Shiras to the body, it locates to Bahu Sandhi, and there it produces symptoms. So this Samprapti has been mentioned. So there is melting of dense Kapha, there is vitiation of Rekta, at the same time there is Vata Kopa also. So as I told earlier, either if only Kapha Rekta vitiation is there, sometimes it may produce some Shiro Roga or Netra Roga or something else related to Urdhvanga. If Vata Kopa is also there is a chance for this Samprapti. This Vata may take Kapha and Rekta to the lower part of the body or to the body, and it may get located in different parts of the body and produce disease. So there is aggravation of Kapha and Rekta and tends to flow. There is dislodgement of Kapha and Rekta to upper limb or lower limb or joints. They localize there and manifest with the different symptoms, mostly with the Shobha. This is another Samprapti. You can see. Shirasa Sravamanena Puranad Asrajasira Parshni Pradhavini Stabdha Prasarana Agunjana Saha. Almost similar to Gridrasi. So when this dosha from Shiras, it passes through the Sira and goes to or affect the Siras going to Parshni and produces difficulty in Prasarana and Agunjana. So this is another Samprapti, another disease coming under Shakha Roga. So there are some attempts to explain other pathologies, other Sampraptis explained in the classics with this dosha Gopa. This is about the Sleepada. We study that Shirasa Prasthida dosha. We have studied the sloga Prasthida Vamshanurvadim Athakayam Kapholbana. So this is explained in Ashtanga Hridaya. Prasthida Vamshana Urvadim Athakayam Kapholbana. So we have studied this sloga. So kapha prasthita, it locates to, it comes to the lower part of the body, to the foot, and it manifests as sleepada. So never I have thought about from where this kapha prasthita, from where this started. So in Kalpadruma, he says that it is from Shiras. Shirasa prasthita dosha kapha praya sharirinam athakayam samasadya. So this starts from the Shiras and gradually it goes to the lower part of the body, athakayam samasadya. There it locates and manifests as sleepada. Never think that sleepada is filariasis. Don't equate like that. There may be many conditions. So this samprapti, so there is a condition where this samprapti can lead to sleepada. In Abaji also, he has explained it the same method. Abhajiknani Thailani Shilayet Shirasodhigam. So he has explained in the Samprapti, he never mentioned about the importance of Shiras. But when we come to the treatment, he says that Abhajiknani Thailani Shilayet Shirasodhigam. So the daily application, that is Shilana, is mentioned. So you have to apply Murdha Thaila or Shiro Abhyanga, which is Abhajikna. So this is mentioned in the Abhaji Samprapti. So not only the Shakha Roga, he used this Samprapti to explain many other diseases explained by some other Samprapti by the classics. So he has tried to explain many such Sampraptis. This is a famous Malayalam sloga. It is from Chigilsa Manjari. Amardam variyum kondu kashayam palumai pibet. Ushnam kondu rugittajam chori vada prasantayi. It's about vada rekta. It's about a kshira bhaga to be taken internally, guluji and shadavari. So this can prevent the rekta vada which occur due to the descent of dosha by Ushna. So like that it is mentioned. So here again, so Vadarekta has been explained in relation to this Samprapti. So this Vadarekta also, as per this reference, Vadarekta may result by a doshagati from head to body. This is from another Malayalam sloga, Malayalam text. Nayana Roga Chikilsa Manjari. Here also it is explained as some kaphagoba occurs in the head that descend to eyes, and it is spread through Akshisida and produces Daha, Srava, Krimi, etc. Here again, in the sloga itself, he has explained as this Samprapti, Neerarakam. So we can see that there are many presentations like Shobha, Vada Shonida, Varana, Pitaka, Pinasa, Apabahuga, Apaji, Kritrasi, Sleepada. All these can be the presentations for this Samprapti. Coming to the management of this disease, we can see that 4 principles are there. It is not clearly separately mentioned, but we can see that there are 4 methods. So Kabhara treatment should be done. We have to do Pitta Rekta Drava Shoshana. So that also should be. So Kapha and Rekta should be treated. It should be Kledahara. After all these things, you have to do the treatments to control Vada also. So by that step only, the treatment completes. So Kapha Rektahara treatment should be done. Kapha Rekta Kledahara treatment should be done. Along with that, you have to do the Vadahara treatment also. There are many conditions, especially we can see in Vadiga Nanatmaja Vigara. Uristambha is considered as a Nanatmaja Vigara of Vada. So how it is related? How we can say that Uristambha is by Vada? There are many other doshagopas also. why Urustambha is mentioned as a Nanatmaja Vigara of Vata. So the explanation is, to cure Urustambha, definitely you have to do some Vadakara treatment. Initially, you might have to do the treatments for Kapha, Medas, etc. After all these treatment, you have to control Vada also. So without controlling Vada, without treating Vada, it will not get cured. So like that, here also we can see that this Samprapti can be prevented by doing some Vadakara treatment also. And there lies the importance of Murdhani Thailam. So practically, you can see in such conditions, there is an order which is usually followed. So in those conditions, first there will be some Shiroleba. In Malayalam, it is called as Talam. For some Ruksha, Tala will be applied, like Rasnadi Churna or some other Churna will be boiled with some Swarasa, like Nirguti Swarasa, etc. And that will be put over the head. So some Ruksha Shiroleba is applied. Then in the next stage, when the Kapha Rekta vitiation gets reduced, gradually we will be shifting to some Snigdha Tala, Snigdha Shiroleba. So there also, we cannot directly go to some Brahmana Taila. There generally, usually we go to some Erenda Taila preparation like Nimba Murdhani Erenda Taila, which is very commonly used. So Nimba Murdhani Erenda Taila will be mixed with the Rasnadi Churna and that is applied. Or tablet Karutavatta is mixed with the Nimba Murdhani Erenda Taila and that will be put over the head. Then in the next stage, Shirabhyanga will be practiced. There also again, there will be mixing of this Erenda Taila with some specific Taila and that will be applied over the head. And in the next phase, Erenda Taila will be avoided and a particular Taila will be advised for applying further. So like that, we can see a series of methods to prevent this Samprapti. This is explained for Shlipada. In the Shlipada treatment, it is explained. Pudam tat tailam atreshtam shiraso yasya shilanat nasyandi tado dosha pragukta padalembina. So Padalembi, the diseases which produces Shobha in the Pada, that can be prevented by continuously applying some oil over the head. Another oil. Here he says that Mulachedat Mahavriksham iva Mūrdhani Prayojita. So like we cut the root which produces which destroys the tree. Like that, if you apply this oil over the head, it can cure the disease. Like that, he has mentioned. Coming to the selection of oil. So Shruta explained this criteria. Tatra pragriti satmya radu desha dosha vigaravi tailam khradam va madiman yujyad abhyanga sekayo. So while selecting the sneha, pragriti, satmya, ritu, desha, dosha, all these conditions should be taken into consideration. So depending on the purpose, disease, conditions, structures, coexisting conditions, symptoms, duration required, or according to the satmya, site, season, etc., there will be variations. So different oils will be selected. These are still there in the practice. For example, seasonal variations, it is still there in the practice. I remember when I was working in Vaidyaratnam nursing home, which is run by Ashtavedya family, Taikatamus. This is a center where this Murdhani Thailam is practiced in a different manner with the due consideration. So they usually change the oil according to the seasons. If the patient is Prachaar, a Prachaar patient approaching in a summer season or in a winter season, there will be change in the oil. So that is considered. So, and again, according to the symptoms, according to the coexisting conditions, comorbidities also, we will have to think of different oils. So this is one part. There is another part. Actually, this is this picture is from fridge. You can see here in such a condition, usually we go for defrost. Okay. So excess Shida can also produce some Samprapti. So here you can see the skannatva, the skannata. So if excess Shida is there, that can produce Vadagopa, or and also it can increase the skannatva of Kapha. So this also can lead to some Samprapti. So there will be painful conditions of head. There are some patients who says that they never experienced any this rhinitis, or they didn't have any nasal discharges in the life. There are some patients complaining of these type of symptoms. As per the text, nasanaha, nasa pudaga, these conditions can occur due to this pathology. So in that, what we have to do, not only Vadahara treatment, by Sneha Sweda, we have to make ulklesana in the body. And by that, this kapha will get melted, and that should be expelled by either some medications or by some procedures like nasya. Okay. So in the fridge also, we are giving defrosting. So like that, we have to melt this kapha and we have to expel this dosha. Then after that, we have to do the Vada Samana also. Okay. So we have to make ulklesha so that this kapha, the skanna kapha will get melted, and that should be expelled mostly by nasya. Then we have to do Vada Samana also. Coming to the ethnographic practices, as I told, there are many such practices which we don't get any reference in any text. And there are some rules for Shirobhanga. Then apart from the classical description of Paga, 3 Paga, there are many additional Sneha Paga explained in Kerala text. Coming to the ethnographic practice, Patra Paga is one of the method usually followed in the practice. Then usually it is applied in small quantity. And there is a method of applying oil in the evening. This is against the rule what explained in the in daily routine, in the Dinacharya. There Abhyanga is explained in the morning, but there is a method of applying head oil in the evening. It is there, still there in the practice. Then instead of this complicated oil processing, some drugs will be put in the oil and that will be boiled, and it is used for applying over the head. Such practices are there. For that also, we don't get any reference for that. There are other measures like Kabbalah, Dhubana, etc. explained for while doing the Shirobhanga. Patrapaga, where only the spoon is heated. First the spoon is heated, then oil is poured into that. When it is cooled, it is taken and applied over the head. So this is called as Patrapaga. This always this helps to prevent some complaints. When some patients say, already I explained, they say that when the oil is applied, they get some complaints. So when we do this Patra Bhaga, sometimes it may get off. It will not be there. So Patra Bhaga helps, and this is there in the practice. So why in the evening? The usual answer is it is a Vada predominant time. And for Shirovasti, evening time is prescribed. So in the same manner, Shirobhyanga can be done in the evening. As I explained, especially in Vaidaraknam nursing home, they apply the oil in the evening. So evening, it's the duty of the masseurs to apply head oil to all patients. So in a specific manner, they will apply it. As per Parasara's reference, he says that dosha shaithilyamayandi vannirandasya varthade sphudi bhavanti srodamsi dinante juritasyahi. So see, he shows the importance of this kala. And apart from this, when it is applied in the evening, definitely maximum time will be available for absorption. So that is another reason why it is applied in the evening. Then the socio-cultural practices which were there in the olden days, that might be also a factor which advises the application of oil in the evening. So in the morning hours, they will be working hard. So only in the evening, after returning to home, they go for Abhyanga. So it was there in the practice. So instead of using these costly oils, they advises, the traditional physicians, they advises some drugs to be boiled with the oil, and then it can be used over the head, like the Grinjanaga, Krishna Jiraga, Parandi Moola, Nirgundi Patra, Yashti, etc. These are very commonly used in the practice. Then according to the condition, you can change the medicines. This you can see now only in the advertisements. It was there in the practice. After applying the oil, after head bath, this dhubana is applied. There are some medications like medicines advised, like Haridra, Sardarasa, etc. explained for dhubana. So these are some of the other practices usually seen. Tanutta enna thechennal tamasichu kulikkanam. That is the reference. When some cold oil is applied, take bath after a considerable time. And if hot oil is used, you can take soon. After applying the oil, soon after you can take the bath. So this is applied. This is there, such a reference is there. Then as I told, there is some variation according to the seasons also. According to the seasons, there is variation in the time. So this is explained in Vaidya Manjari, which is again a Kerala textbook. There, the left side, these are the Malayalam month, the season. I have written the season also. So in the Hemanta, it is 48 minutes, Vasanta 72 minutes, Grishma 24 minutes, Varsha 144 minutes applied. Then in other months, immediately we have to take bath. So such a reference is there. That means according to the seasons, not only there is change in the selection of the oil, the duration of application is also varied. This is another practice. When keraleeya is used, bath is advised. And mostly it is applied in the morning. When tilatayla is used, usually it is advised to wipe off it with some cloth. Never take bath, you wipe it off. That's all. And mostly it is applied in the evening. So these are there in the practice. Noon application considered as the worst one. Actually, I belongs to Kottakkal. So Kottakkal belongs to Malappuram district, which is a Muslim predominant district. Here usually, especially the ladies, they take head bath in the noon. So the morning they will have many duties. After all work, they go for bath. After applying the oil, they take bath in the noon. And many of those get some complaints like the neck stiffness, etc. So when the neck stiffness or neck pain is presented, usually we ask about the time of head oil or time of head bath. So when we change this time, we ask them to take head bath in the morning or in the evening after 5 o'clock. So when we change this time, that itself can cure the complaints. Then there is a practice of using multiple oils mixed. As I told, Nimbamradadi Eranda is mixed with other oils and it is applied over the head. We will be doing the Patrabhaga. After Patrabhaga, it will be applied over the head and that will be continued. Then after a while, after when the patient is okay with the oil, then Nimbamradadi Eranda will be stopped. Only that oil will be prescribed further. So this type of mixing of oil is also seen in the practice. In Vaidyamanjari, according to the age, dosha, disease, etc., Snehapaga is varied. So here you can see Balanam Amradakenam Yunam Merigilum Mupattanjinum Elenna Gharama Shastigam Vidu. So according to the age, the paga is varied. For Bala, Amrita Paga is mentioned. For youth, Meruga, that paga is explained. Then from 35 to 60, Kharapaga is mentioned. So above that, Chikkanapaga mentioned. Above that, Kaduga Manala. These pagas explained. Adinu melulla padam kadugum manalinnadum. So as per classics, we have only 3 paga. Okay, Murdu, Mathya, Khara. So only these 3 paga we have studied. Here you can see there are some other pagas like Sarshaba, Sikada or harder than Khara, etc. mentioned. Mupattanjinumelenna Kharama Shastigam Vidu, Adinumel Enbadolam Chikkanam Padamayadu, Adinumelulla Padam Kadugum Manalendu. Actually, I couldn't I couldn't identify these pagas. Just I have asked about this to some of the physicians, but I couldn't get the real difference between or what is these pagas. Anyway, apart from the 3 classical paga, they have identified many other pagas also. Kaduga, Manale, or more than Khara, these pagas are, it's not Daktha paga, they have identified certain other pagas. Then according to the constitution, to the Prakriti and Roga, they used different pagas. So this is another reference. Again, it is in Malayala. Pittadehikku Merugin Uttadaitirikkanam, Vadamerunna Dehangal Kokkayum Chikkanam Padam, Kapapradhanam Ennagil Kadugennu Paranjadu, Kapatil Kapamenagil Kalkamellam Manal Padam, Kapatil Vadamenagil Kadugai Varum Padam, Kapatil Pittam Ennagil Chikkane Udirum Padam. So you can see one is the condition of the disease, the dosha koba of the disease, then which prakriti is affected. So when a particular prakriti is affected with some other dosha, different pagas are mentioned. So kaphatil kaphamennagil kalkamillam manal padam, that is, if kapha prakriti gets a kaphaja disease, manal paga mentioned. If kaphatil vadamennagil, if a kapha prakriti gets a vadakoba, kadugai varum padam. So there the paga is different. So you can see the thing is that they had a knowledge to identify all these pagas. So such a practice was there in Kerala. Okay. This already I mentioned. duration of application of the time. In one oil, it is mentioned for 3 nadika, that is 72 minutes. But generally, in practice, only 30 minutes it is advised. After 30 minutes, either the patient is advised to take bath or wipe it off. Okay. Coming to the current situation, current scenario, nowadays actually it is not considered as a part of current lifestyle. Most of the people not apply oil regularly over the head. Those who apply, very few people apply it on the vertex. Most of them prefer it only on hairs. Most of the people, they apply over the hair, not on the vertex. Modern people, modern medicine people, they don't have such a theory. So always they deny its effect, and rather more than that, they say that this head oil can create many complications. So they never support the effect of Surya-Abhyanga. Even the Ayurvedic physicians are not confident about this. So see, these references, this Arogya Raksha Kalpadharma reference or Vaidya Manjari references, these are not well known in our community. Those who read, those who have vast reading, they can identify these references. Many of our community does not know these references. So they are not confident with this treatment, Surya-Abhyanga treatment. So definitely they don't have they don't support this Surya-Abhyanga, and rather they support the negative effects. This is usually seen nowadays. And nowadays we apply the Surya-Abhyanga only as a part of Samsveda procedure. Because when we do some Sweda procedure, first head oil is applied. This is also nowadays it is rare. Just once we saw in our hospital, we looked the Sweda procedures, and we have seen we took the medicines intended for that. So only the Panchakarma people advised head oil, and no others were sticking to the head oil application. So the application of Surya-Abhyanga is getting reduced in our practice. Still, I can say there are prevailing traditions who use the head oils logically, according to the condition, according to many factors. Considering these factors, they use this method, and it can give wonderful results also. Since we are not using these specific oils, you can see there is a significant reduction in the number of head oils in the market. I'm not telling about the hair care oils. Specific oils mentioned to prevent or specific oil mentioned for diseases, the number of oils are getting reduced. And of course, hair oils are getting increased in the market. And oil application has been considered as a inappropriate use of head oil is considered as a risk factor for many conditions. It is also there. So Surya-Abhyanga it is a procedure more than mere application. It is effective in preventing certain pathologies. It can be considered as a route of drug administration. And this tradition is getting faded. Surya-Abhyanga is more than a bath accessory. It is more than a cosmetic practice. It is more than a hair care practice. It's more than a head coolant. It's more than a sleeping comfort. It's more than a compulsive obsession. It's more than a belief or a placebo. It has a say in health or illness, and it's a reality. There are many traditional knowledge, treasure of traditional knowledge about the clinical conditions and their management. We have to do a comprehensive analysis of these type of practices, and that should be researched and we have to stick on to, or we have to take these knowledge into our practice. So I give special thanks to Dr. K.V. Ramamurthy sir, Dr. P.K.V. Anand, and Dr. Subin Vaidyamathan, who has given many inputs for the preparation of this topic. Actually, Ramamurthy sir is the right person to talk about these practices. He gave a lot of information. Still, he is giving a lot of information about many of the practices, traditional practices. So I am greatly thankful to these three people. With this word, I would like to conclude my presentation. Thank you. Thank you all.
Thank you, sir. If any of the students has any questions for sir, you can unmute yourself and ask. In the meantime, sir, we have a question from Dr. Anjaneya Murthy. So, so he is asking about minimum and maximum duration of each day of Shirobiju has not been mentioned. So he says that Gandha Pratiti and Rasa Pratiti told under the Shirobasti have to be taken here also. So he is saying if he is correct or not regarding the Shirobiju duration.
Yeah. In the Shirovasti, actually, the NASA Akshi Srava explained, and I am not sure about that, whether the Gandha Pratiti or Rasa Pratiti can be taken as a indicative of the time. Anyway, now one research is going in our institute regarding the Samyak Lakshana of Shirovasti. So, sir, definitely we will consider these symptoms also. We are not sure about the Samyak Lakshana of Shirovasti. In general, in most of the practice, we do the treatment for the prescribed time. So generally, in many practices, it is explained as 1 muhurta to 2 muhurta. This is the time generally seen in many of the procedures. If we see the many procedures like Shastri Vindaswada, etc., there it is explained as 1 muhurta to 2 muhurta. So this can be taken as a standard, I think. Of course, I can speak about the time after completing that procedure. Anyway, that's a good suggestion. I will see into that.
Okay, thank you, sir. Sir, actually, Dr. C.P. Verma asked the question in the chat. The question is that, can you please suggest some commonly used head oils? But this, I think, is like a very simplified version of your entire lesson. But sir, that is still a student question. So, can you share?
Sir, you can go to the different formulations. Mostly it will be from Sastra Yoga or Ashtanga Hridaya. You can see the drugs in that, and based on that, you can have an idea about the property of that oil, like whether it is Ushna, how far it is Ushna, how far Shida. So based on that, and also there may be some specific indications that may be taken as a base for this, and based on that you can think of its qualities also. it will take a lot of time. Of course, I usually present about the formulations also, but it will take a lot of time.
I understand, sir. Thank you, sir. Maybe we can have a much larger discussion on a practical level later on. Sir, another question from Dr. Harish is that in neonates, there is a practice of application of different oils. Does it have any reference to granthas, or
Yes.
can you elaborate the
Yes,
practice?
as I told, Arogya Raksha Kalpadrima, nowadays its English translation is also available. It is actually it is considered as a text from Balachikitsa. It is about the Balachikitsa, but at the same time it contains all other treatments also. In that you will get the reference of many oils, as I described. You will get many oils in almost all conditions. He prescribes some medications over the head in many conditions, not in all. In conditions like Visarpa or Vadarakta, etc., and many other Shiro, Netra, Gadarogas, he advises different oils. And apart from that, he advises the intake of these oils internally also. I think nowhere else we will get the reference of intake of this coconut oil internally. In Arogya Raksha Kalpadrima, it is mentioned. So you can go to, you can refer Arogya Raksha Kalpadrima.
Okay, sir. Thank you, sir. And next person is Dr. Babita, and she asks, in Mudra Kritra, which oil is used, and how Virechana can be done in the case?
See, actually, I have shown a reference from Sarvaroga Chikitsa Note. This is another important thing. We will have many references, and in what condition it should be practiced. This we have to find it out. So far, I didn't practice the head oil in the Mudra Kritra. Now only I got this reference. So I'm not able to tell about any specific oil. He advises Shida Taila over head, like that he mentioned. Then Virechana, many times we use the Virechana, like generally we use the Erenda Taila, especially for these purposes. Sukumara Erenda Taila or Nimbamurdadi Erenda Taila, Hingutragana Taila. These Taila can be used for Virechana.
Sir, again, Dr. Saurabh Chaurasya, the oils which can be used for migraine daily, which can be prescribed daily.
See, there are many oils in migraine. Again, I would like to suggest you go to the preparations. In the migraine also, there are a number of oils are available, like Balahadadi Taila is there, Nishkalkan is there. Many oils are there. If you identify the condition, even including the Nimbamurdadi Erenda Taila will be helpful in such conditions. So please refer to the formulations where Shiro Ruja is mentioned and identify its guna and apply in the clinic.
Okay, sir. Thank you, sir. I think we have robbed so much of your time today. So I think those doubts are also finished. So we can conclude the session. Sir, we have seen so many variants of head oils in many pharmacy books and shelves, and but hardly understood the principles behind applying these. And it is hardly a knowledge one would find in clinical texts or in seminars or in published literature or case studies. So, and also I think you explained some basic principles of even teeth ache or conjunctivitis or fibromyalgia. All these common diseases are all explainable in the principles of that you have taught us today. The nuances of preparation of oils like additional pakams are something many of us are hearing for the first time. And the application of oils such as thara and the head, this spa massages without knowing the power of Murdhani Thailam can lead to, bad effects for the patients and ourselves. So Krishnakumar Ji was intended in preserving and sharing such wisdom for the next generation. So we had this, we are glad that we had you with us to enlighten on such an obscure subject. Thank you for this invaluable lesson, sir. Thank you so much.
Thank you. Thank you. Thank you for patiently listening.
Dear students, this class will be available on our Facebook, and I will share the link with you on the group. Thank you for joining us for Prachaar 2022. Good evening to all. Before leaving, we